First, in a very special report, our award-winning producer Paul Levine shows us 2 cases where robotics helped surgeons perform very successful operations.
When Rob Tucker and African-born Ernestina Menavur were married in May of 2005, they were looking forward to starting a family. But weeks turned into months, and still no pregnancy. So Ernestine began to realize that something was wrong.
I went to 3 doctors, and they all had the same story. I have fibroids, which we knew already. But in terms of me getting pregnant, one of the doctors actually told me just to go and make baby after I did all the tests that they recommended. And I guess they figured the fibroid was not in the way and I could still conceive.
But it was only after Ernestine turned to Newark Beth Israel Medical Center and sought a 4th opinion with Dr. Michael Pitter that things took a turn for the better.
So here are the results of your MRI that was done.
He took the time to explain things to me, not like that. We sat down and he told me exactly what the fibroid was, and he recommended some tests which I should take.
He also suggested that a cure just might lie with a new type of surgery.
Robotic surgery I define to my patients as computer-enhanced laparoscopic surgery. So rather than using the word robotic, which implies that a machine is operating independently of the surgeon, I try to put it in the context of laparoscopy, but with a twist.
Over the past 2 years, Dr. Pitter has performed over 200 gynecological surgeries using the Da Vinci S surgical system. And the benefits, he says, are innumerable. Shorter hospital stays, less blood loss, and quicker recovery. And even more importantly for patients like Ernestine, this procedure is more precise.
You're able to get to the specific location that the fibroids exist, dissect them carefully from those areas without any damage to adjacent myometrium, if you will, or structures of the muscle. And so by being able to be more precise in the dissection, the integrity of the uterus afterwards is not compromised as much.
And that became abundantly clear just 4 months later.
I missed my period, took a pregnancy test, and voila, there we go, I was pregnant. That was the best news ever.
On January 25th, Ernestine and Rob became the proud parents of a 6-pound, 13-ounce baby boy. They named him Taji, which means crown in Swahili. Today, Taji is a happy and healthy 8-month-old, and his parents couldn't be more pleased.
I'm extremely grateful for Dr. Peter. I mean, he's really a godsend. I'm glad that he came into my life. So I'm hoping the second child, he's around for that.
For 47-year-old Michael Scalgione, the benefits of robotic surgery will also have a lifelong impact. Earlier this year, he was diagnosed with prostate cancer.
I didn't notice anything was wrong. I went for a routine physical, and my PSA came back slightly elevated, and my regular physician sent me to a urologist, who in turn sent me for a biopsy.
This year, over 200,000 men have been diagnosed with prostate cancer. If caught early, it can be cured. But that cure has often come with a big price tag: incontinence or loss of sexual potency. That is, until recently. In 2002, the Food and Drug Administration approved the use of the Da Vinci robotic system for urological procedures, including prostatectomies, or surgery to remove the prostate gland.
Robotic prostatectomy is a minimally invasive procedure that's done laparoscopically, but with the use of a computer-assisted robotic surgery.
The way that the robotic instruments handle, they basically simulate the movements of the human hand. So any movement that I perform to control the robot will simulate a movement inside the body of a human hand. The instruments will make right angles, they can spin, they can open and close, they can move in and out. They have all the degrees of freedom that a human hand would have, but more.
While Dr. Esposito works the robot, Dr. Lanteri assists at the operating room table.
The assistant's role is to make sure that there is retraction during the surgery, make sure that the field in which the surgery is being done is clean, in the fact that there's no bleeding, so you have a clear field throughout the operation.
And with the use of a brand new 3D vision system, the assisting surgeon can now see exactly what the operating surgeon does, so they can work in tandem.
The benefit to the patient with this surgery is shorter hospital stay, minimal pain, ability to regain their urinary control on a timely basis, and the ability to get erections as well. The paramount portion of the operation, cancer cure, is always first in our eyes.
Together, Doctors Lanteri and Esposito have done this surgery over 900 times now. Their experience is one of the reasons Michael chose them to do his surgery.
I met with Dr. Lanteri for about an hour, hour and a half, and he just showed me diagrams, what to expect, you know, the negatives, and told me all the positives of the robotic surgery. And then I also found out that they were teachers of it too, so what better person to go to than a teacher?
Michael had his surgery on a Tuesday and left the hospital the following day.
I was a little weak, but I remember walking around the block. They wanted you to keep moving and walking.
And within a week, he was back to work.
I was just working my computer, driving my truck. And the following Wednesday, which would be 10 days, I was working on my own, lifting boxes without any problems.
And even more importantly,
the sexual functions came back to normal, I would say, within 10 days, which was a total shock. And the incontinence, I didn't have any. I've heard a lot of horror stories. Now, I don't know if I'm just a special case, but anybody who asks me, I just tell them the good things about it, because that's all I could tell them. All I know is with this robotics, it's like a miracle for me.
Clearly, these are great stories that show us how the St. Barnabas healthcare system is integrating the latest technologies into surgery, early detection, and other procedures.